The International Labour Organization has released its flagship Social Protection Report 2020 to 2022, titled Social Protection at the Crossroads in the Pursuit of a Better Future. The report provides a global overview of recent developments in social protection systems, including social protection flaws, and covers the impact of the COVID-19 pandemic. The statistics, though, are pretty grim, with more than half of the world's population not having any form of social protection. To tell us a little bit more about what's in the report and what it all means, I spoke to the ILO Director General, Guy Ryder. Mr. Guy Ryder, the Director General of the International Labour Organization, thank you very much indeed for joining us and welcome to the program.
Thank you very much for having me.
Mr. Ryder, this report, the World Social Protection Report, paints a pretty grim picture that says billions of people are not enjoying any protection at all, social protection at all. What does that mean?
Yeah, that is really the bottom line of our report, that the majority of working people have no social protection whatsoever. It's only 46% of the working population that do, and that leaves just over 4 billion people beyond the coverage of social protection. And I think COVID-19, the pandemic that has struck us in recent months, is exactly what reveals what this actually means. It means when life's problems catch up with you, when you lose your job, when you get sick, when you get older, which happens to us all, if you've got no social protection, if you've got nothing to fall back upon, these problems become existential. When social protection was being originally put in place a few generations back, the slogan was freedom from fear. And I think absence of social protection means, regrettably, tragically, people are living in fear, that basic insecurity about how they're going to get through the future. And COVID-19 has really highlighted that reality, hasn't it? Because if there's one difference which defines how we've lived this pandemic, there are those who can fall back on social protection if they can't work, if they need sick pay. And, it's inconvenient, it's not nice, but you can get through. And there are those who don't have social protection, and for them, what is an economic or a social problem rapidly becomes an existential or a humanitarian crisis. And that's why we think that this struggle to move towards universal social protection is really so important.
So when you compare the last social protection report to this one, yes, COVID-19 was certainly one of the big items in between. But I guess it also highlights the inadequacy of some of the protections that were there, because this time they were really tested for the first time, perhaps.
Well, that's right. I described COVID-19 as acting like an X-ray scan on our societies. And what did the X-ray show? It showed the inequalities, the divisions, the absence of social protection for so many people. And when COVID-19 struck, these inadequacies became very, very clear to us all. So nobody can look honestly at the COVID-19 experience without observing that pre-existing social protection systems were badly underfunded, underinvested in, and simply didn't provide the protections needed. So what did governments do? Well, they've reached out and they have, on an ad hoc basis, put in place, on a remarkable scale, temporary measures of social protection to get people through. Just to give the example of the G20 countries, of which South Africa is one, G20 countries last year put in place ad hoc measures which reached some 650 million people. It helped them out. But I see the danger now, as perhaps in some parts of the world, the pandemic recedes and people are saying, look, we can't sustain this major fiscal effort. Some $16 trillion have been spent fighting the economic and social consequences of COVID. As that becomes unsustainable and we have to go back to normal conditions, then these emergency measures will be withdrawn And I think the danger is we simply go back to where we were pre-pandemic. And we have to do better than that. And that's why we talk in our report about being at a crossroads. Either we go back to where we were and muddle through until the next crisis strikes. We call that the low road on social protection. Or we try and do better. We learn the lessons and we make a commitment nationally and internationally to say, we're going to fill the gaps, we're going to overcome the inadequacies, and we are going to move towards this goal, which is established in the United Nations 2030 agenda of universal social protection. And this is the high road that our report is arguing for.
The report points to Africa really at the bottom end of social protection. I mean, the percentages are quite alarming, especially when you compare to the developed world. Do we know why Africa is so low down the scale in terms of social protection for its citizens?
Yeah, I think you're right to point to the percentages, which are truly alarming. I'm just checking them as we speak. I gave you that global average of 46% of people with at least one social protection benefit. In Africa, that figure is 17%. Regrettably, it is the lowest on the globe. Why is it the case? Well, I think you have to point to issues of development. The fact of the matter is the least developed countries, the low-income countries, not only spend less in absolute terms on social protection, they do in relative terms as well. What do I mean by that? Well, the developing world spends about 16% of its GDP on providing social protection. That's the rich countries. For the least developed countries, it's just over 1%. So in absolute and relative terms, there is massive underinvestment. And I think the question before us, and I don't think we should avert our eyes from it, is how are we going to make possible the type of investment that is now required to improve this very unequal and very alarming situation to which you've pointed. Here's another figure. For the low-income countries, I'm not speaking only about Africa here, for the low-income countries, it would take $79 billion each year, it's a recurrent expenditure, to close the financing gap for basic social protection, the minimum that we think is required. Now, $79 billion sounds really like a very large amount of money. It is a large amount of money. But put it in context. As I've said, in the course of this COVID pandemic, 16 trillion with a T US dollars has been spent on COVID-19 economic and social response. So my point here is what might pre-pandemic have been regarded as an unachievable and unreasonable investment of resources, I think in today's perspective looks eminently reasonable, and more than that, absolutely necessary, because the percentages we're looking at and the inequalities they reflect are simply a morally unacceptable situation in the world today.
What do you say to our governments who'll say, look, we just don't have the money or the resources to allocate so much of our GDP percentage to social protection? There are other more pressing areas. What do you say to that?
Well, I mean, we hear this. This is not an imaginary problem, it's a real problem. And we all understand that governments do, particularly after the spending efforts of COVID-19, often face very tight financial situations. That is well understood. I think there are three answers to your question. The first answer is about priorities. You know, you make the point, well, maybe there are more important things to spend money on. It's difficult to think of what priority should stand higher than the priority of freeing people, often very vulnerable people, include children, old age pensioners, women who are expecting or have given birth to children. You know, who is a higher priority than them? So I think that these priorities should stand very high. The second point is, notwithstanding the constraints that governments everywhere face, and those constraints are often greatest in the developing world, you know, our experience shows that there is always space to do a bit better, to design national policies, to improve the tax take, to actually invest, find fiscal space to invest more in social protection systems. We see countries at very similar levels of development and of per capita income, which make very diverse efforts in terms of social protection. Some do better than others, and that indicates that there is policy options, there is a policy space available. But the third part of my answer to your question is undoubtedly that there is an international dimension to this global challenge. And I think there we simply have to do better in the whole agenda of international financing. So those of us working in international organizations, including the international financial institutions, the IMF, the World Bank, we really have to work with nation states now to make sure that they do receive the type of support that they need. And the sort of partner to that thought is that we have to design social protection systems. Sometimes these are complex questions to deal with in an efficient and an effective way. We have to help the people who are really most in need.
Your report talks as well about recommendations, key policy recommendations. What might those look like, particularly for our region, Africa?
Yeah, well, we have put some recommendations in there, and they reflect to a large extent some of the points I've been making. Firstly, I think all countries need to make social protection provision an element of national policy and priorities. So we need to see national social protection plans where they don't exist. And I think these also need to be directed towards ensuring the minimum necessary social protection levels for all categories of workers. We find in many countries that some categories of workers are quite effectively covered. Could be public sector workers, formal workers, but often the informal worker, the self-employed worker, and in a sort of a different optic, the new generation of gig workers are excluded. So we have to design policies which cover everybody. We have to prioritize those who are clearly the most vulnerable, and I return to the issue of children and of maternity benefits as well as old age pensions. And then we do need to bring this international dimension to the fore. And this is not an idle hope, I think. In the UN General Assembly, which will assemble next month, there is a high-level meeting. The Secretary General of the UN is going to open it on social protection and poverty, and this in the context of the Financing for Development agenda, and this with a view to mobilizing the international community, I would say at a higher level of ambition and commitment than has previously been the case. And my goodness, if we needed a justification and a trigger for that stepping up to the plate, it's surely COVID-19 and the human suffering that it has brought.
That international help, I mean, what form does it take? Are we talking about financial aid packages geared towards social protection in particular?
Yeah, we have a number of proposals before us right now. One proposal which is out there is to create a global social protection fund, which would do precisely what you're indicating. That is to say that at a time when, and I'm aware of this, there are many competing calls on finances. You know, we're still in the business of climate finance as well as vaccine finance, educational finance, health and care finance. You know, there does seem to be a need to carve out a priority for social protection. So that's one possibility. At the same time, we're seeing that the International Monetary Fund, for example, is approving an initiative for the issuance of SDR, special drawing rights, which basically is creating international liquidity and finance. It would be, I think, perfectly feasible to integrate a social protection channel into that type of finance. And there are other options as well. But the point here is that we have to explore these options and make sure that we don't just nod our heads and say, yes, we really must do a bit better with social protection, but we move to concrete action, taking up any of these options, maybe all of them, but in a way that makes a difference to the people who most need the assistance.
I mean, the argument for social protection being a just and moral thing to do I think there's perhaps a bit more to this as well, isn't there? I mean, when we start to see social unrest, largely it's because people are not protected.
Yeah, I mean, there's a whole series of arguments you can bring to back up this call for better social protection. I still think the moral and solidarity argument, freeing people from fear, is the first piece. I would say equally, by the way, that effective social protection is a very good investment in economic success. You know, if you're trying to move people from one part of the economy to another as technology takes a hit on some sectors and promotes others, if we're trying to adjust to the new green jobs that we need because of climate change, to help people make the jump from one place to another, you need to offer them protection. Otherwise, they'll stay put where they are. But I agree as well, and we know there are some painful experiences around the world to illustrate the point, that if you leave people in destitution, if you leave people to fend for themselves in the most adverse circumstances, if the state, quite frankly, doesn't take up the responsibilities which properly belong to the state to protect and to provide for their citizens, yeah, desperation sets in, doesn't it? Desperation sets in, and that is sort of dangerous tinder for social unrest and disruption, which nobody wants to see. So you're absolutely right. There's a whole panoply of reasons why all of these issues need to be right up there at the top of our leaders' agenda.
Social protection has quite a wide range of packages and needs. And I wonder, is there a hierarchy in terms of the kinds of protections that you must do first on a list of protections that perhaps have the highest impact?
Yeah, I think there's two ways to look at that. One is the categories of protection that you need to provide. You know, the most successful category of protection, in the sense of the one which is most widespread, is old age pensions. Old age pensions are now available, paid to over 77% of people of at the age to have entitlement to them. So I think societies have seen those as being fundamentally important. And let's be honest, we all get old one day. But we categorize different types of social protection. We don't give them a hierarchy of importance. I've mentioned child benefits, I've mentioned maternity protections, sickness insurance, unemployment protection. Only 1 in 5 of the unemployed actually gets unemployment benefits today. I don't put those in a hierarchy. I think there's a slightly different way of looking at this, of slicing the question. And that is between contributory insurance schemes, those types of schemes that workers and their employers pay into, and you build up entitlements over the years. I think we're all familiar with that type of thing. And then the tax-based general protection systems. And if you look at it and step back and look at it in a more broad sense, we talk about social protection. We have instruments, we have mechanisms which deal with fully fledged social protection, contributory systems, and then we have the idea of social protection floors. That is to say, the absolute minima of basic needs that need to be covered by the state through taxation or other policies. And I think that in the circumstances in which we find ourselves, given the challenges of the informal economy, for example, in which 6 out of every 10 workers in the world is engaged right now, this notion of putting in place social protection floors for everybody, and I know this debate on universal basic income is alive in South Africa, I think this needs to be perhaps a priority given the exigencies and the urgency of the moment.
I think you may have slightly answered my next question. Africa has got the youngest population in the world, and our women are the primary caregivers. And I suppose social protection probably needs to be geared towards those groups much more than the others, one would think.
Yeah, I mean, one element of your question should give cause for optimism in Africa. That is to say, with a young population, you will now and in future years have a much better ratio between working age population and dependent populations, old age pensioners and the like. And that's got a very positive consequence for the sustainability of social protection systems in aging societies like the one I come from in the UK and the one I'm sitting here in Switzerland. There's a real problem because there are more inactive people to active people, and that places a strain on the obvious actuarial sustainability of social protection. But your point, I think, is a slightly different one in addition to that. Yeah, we do need to do much better in providing. I'm going to focus on the issue of women and caregivers, as you've said. You know, we talk a lot, don't we, about the gender pay gap, that women tend to get paid less than men, and that comes in about 20% less on a global average. But there's also the problem that women actually do much worse on social protection entitlements. Why? Because they very frequently interrupt their careers, their professional careers, and therefore their contributions to social security systems. Our social security systems are still bear the historic sort of hallmark of the notion of a single breadwinner in the family who is the man upon whom the woman is dependent. And, you know, we have to redesign and re-examine our social protection systems so that we don't generate this social protection gender gap, which is very, very evident around the world. And that's in addition, of course, to the whole issue of maternity protection, which I've talked about already.
Perhaps finally, the 2030 Sustainable Development Goals agenda, do you think that we can meet it? It looks like Africa has a much longer way to go than other parts of the world, but can it still be done, do you think?
It has to be. I mean, your question is a great question, and it's a really important question. You know, back in 2015, the world decided to set itself 17 goals of sustainable development in this 2030 agenda, and to achieve them by 2030. I mean, this was a global commitment. Heads of state, heads of government, everybody signed up. Now, before COVID hit, and it's the Secretary General of the United Nations who says this, not me, we were behind. We were off track on practically all of the 17 goals. That applies to health, that applied to climate change, that applied certainly to the world of work, all the things we've talked about. COVID-19 has made it even worse. COVID-19 has made it even worse. So, and I think this is the question which our leaders now have to respond to right now. Do we take the 2030 agenda as still current? Is our commitment still in place, or do we have to give up? And it's very clear the message coming from the United Nations, a message coming from national leaders is our sign up to the 2030 agenda still holds good. And that's great. I think it's absolutely the right thing to say. If we mean it, we have to mean it. And if we mean it, then we have to take, for example, have a look at this report on social protection that the ILO has just put out, take it seriously and act on it. This is the type of action that we're prepared to take. These are recommendations we will act upon. This is a financial effort that we are prepared to make and get on with it. The 2030 agenda is still in reach, but it won't happen on its own. And that's just the simple truth of the matter.
Mr. Guy Ryder, Director General of the International Labour Organization, thank you so much indeed for joining us and giving us some insights on what you found in this report on social protection. Thank you.
Thanks a lot.